Today's topic is around behavioral health, and I would like to welcome Christine today. And the first thing I would like to have her just share is, Christine, if you wouldn't mind just talking through your background and career journey up until this point, and we'll kind of dive into the Lakeshore Community Health organization and what you currently do. But if you just wouldn't mind walking us through, the past years of your life that got you up into this point and all the other experiences that you've had.
Sure, sure. Yeah, because knowing that there's several, mostly, right, high school students on
Yep.
the call, I think it does bring me back to kind of how did I make that decision, and I'll talk a little bit about that. So I went to high school in a really small town in Wisconsin. Horicon, Wisconsin is where I grew up and went to high school. And when I decided to go to college at UW-Madison, I had no idea what I wanted to major in, literally no idea. And back in those days, I mean, this is late 80s, it maybe wasn't quite as specialized as it is now in terms of trying to choose your track and figure out. And we certainly didn't have anything like Inspire to help us kind of hone in on that. So when I went to school, I went as an undecided major, and I remained undecided for the first 2.5 years that I was in college. So I like to tell students that story because I think a lot of times people are so afraid of being undecided. But I think for me, it really allowed me to take coursework that maybe I would not have otherwise taken, and it allowed me to take the classes that were most interesting to me. And so what that led to ultimately was a double major in sociology and psychology. I took classes that just looked good. And then once I found the instructors that I really connected to, it was then easy to kind of like, I'm going to keep taking their classes, or I'm going to keep looking to see what they're teaching next semester. By no means was it easy. And there were definitely points in my college career where I thought things were too hard and I didn't know if I was going to make it through a semester or all the way through to the end. But I did with that double major. I also had a really difficult experience during my college years that actually led me to my own course in therapy. And I think that was definitely a big influencing factor for me. What ultimately led me to kind of say, I want to somehow be working in mental health. I was involved in a really terrible car accident, which led to my own experience in therapy. And later on down the road, I wasn't really sure what area of psychology I wanted to get into. And I applied for a job in a research position to do research in the psychology department at UW-Madison. And I was not chosen for that job. And I like to tell this story to students too, because I said I felt so sure that that was what I wanted to do. I wanted to get this job in research, go to graduate school, become a psychology researcher. That's what I wanted to do. I did not get that job because there was well, it doesn't really matter. I didn't end up getting that job. I took a job at a group home, a local group home that was run by Goodwill Industries in Madison. And that was kind of my first experience working with individuals with severe and persistent mental illness. And I really ended up loving that job. And I think that was really the job that led me into other jobs similar to that. That's what kind of led me to a place where I was like, community mental health was what I wanted to do. I wasn't even sure at that point what area of community mental health I wanted to do, but I did that job for a couple of years. And now, since that time, I've worked in so many different areas of mental health. And I think I often tell people you kind of just have to look for where doors open up and where that might lead. And I think that I've been really fortunate in that way to work in several different positions that were just great positions for me. I learned a lot and they led me to different places. So just some of the jobs that I've done in the past, I worked at that group home with individuals with severe and persistent mental illness. I then decided to continue my studies after my bachelor's degree, and I went on for my master's degree in community mental health. I worked in a rural community mental health center doing case management in a community support program. I worked on an assertive community treatment team in New York when I lived out east. I've done private outpatient work in just a small community clinic. And I've also I've worked in college mental health settings, both at Lakeland University and at UW Sheboygan. And that was how I first got connected to Inspire Sheboygan County. So I've worked in a bunch of different areas of mental health. Do you want me to go into my current position yet, Nikki?
Yeah, well, let's, actually, that'd be a good time to pause quick too,
Okay.
because I think some of the education components are for students. They're wondering when you go off to a college, likely to a 4-year institution, where do you start? Like what would be a typical major if someone had an interest in becoming a
Hmm.
behavioral health counselor, or what kind of classes would you recommend them taking early on to make sure that that was a good fit?
Right, that's a good question. I think some of the classes that are really helpful for somebody to take early on would be introduction to psychology kinds of courses. You do have to get through a certain amount of statistics and math just to get into a psychology program, in a bachelor's program in psychology. So once you're in a bachelor's program in psychology, you'll be expected to do a certain amount of statistics and research so that you can understand what the research in psychology is. I think those were the classes that for me helped me determine that that was what I really wanted to do. When I took intro to psychology, that led me into other areas of psychology, and then there were courses like abnormal psychology, which teaches you all about disorders within psychology and what happens to people's mental health when things don't go right or don't go well. And that was another course that I loved that course. And so I think that also helped steer me in the right direction. The sociology part, for me, at least in my background, I think was more about the social understanding of, why does society shape us in these ways, or what influence does that have over us? And I think that different directions that people can go, and I'm sure we'll talk more about this, but people can kind of go in the direction of social work. There are social workers in a multitude of different settings, like hospitals and clinics and nursing facilities and places like that that can also help people get connected to community resources and a variety of different social programs where people that have social work degrees can do. People with social work degrees can also get their master's degree and do very similar work to what I've done in my career. So whether or not you choose to kind of go the social work route and become a licensed social worker, or whether you choose to become a licensed psychologist or a licensed professional counselor, both areas can end up doing clinical work with individuals. It's kind of a confusing area because people, and even when I was younger, I didn't really know what those differences were and how would I know which direction to choose. And I guess what I would say to people is once you're in a university setting, you can talk with your instructors, talk with the different faculty members to figure out like which is the better area for me to get into.
Yeah, and definitely I know as things open up, going out to maybe reaching out to some social workers and learning a little bit more about what that job entails will also help you to make those decisions.
Right. Right. Doing as many job shadowing opportunities as you could, I think would be really helpful to know like what setting do I see myself working in?
Awesome. Yeah, that's great. So let's talk through now what you do. So you work for Lakeshore Community Healthcare Clinic, and your title is, are you a behavioral health therapist?
Right. So I'm a behavioral health therapist at Lakeshore Community Healthcare. And for those of you who maybe aren't familiar with Sheboygan or Lakeshore, Lakeshore Community Healthcare is a federally qualified healthcare center. And what that means is we are able to serve underserved populations for enhanced rates of pay. So people who maybe have state insurance or federal insurance are able to access care at our clinic. And what we provide is an integrated care. And a lot of people, this is kind of become a big buzzword in the healthcare right now is integrated care. And what it means at Lakeshore certainly is that we have a team of individuals and different parts of health that we're able to treat all in one place. So at Lakeshore, we have a medical team, we have our own pharmacy, we have our own dental clinic, we have behavioral care, we have chiropractic care, and we continue to kind of add and enhance like what kind of services can we offer. We're now starting to offer gynecological services and other types of services for our patients as well, so that they don't have to go to a bunch of different places to get their care. They can get all of their care needs in one place, and we work as a team. So we communicate very regularly within the team about all the care that somebody would need. So I work on a team with other people, which is really what brought me to want to work at Lakeshore. I mean, I loved my job at UW Sheboygan, and when I was doing outpatient therapy, I loved those jobs, but I was very attracted to serving individuals who were in greater need. So, sort of an underserved population. I had that background and really wanted to get back to that. And I think the other part that really attracted me was being a part of a team. I've always loved being part of a multidisciplinary team where there are people of different specialties really trying to work together, communicate together, and really provide the best care to the patients. So my job is kind of a mix. I do traditional therapy at my job, so there are certain patients that I see on a regular basis, and what you would think of as more traditional behavioral health, a 45-minute session, really working on mental health goals with those individuals. And then the other part of my job is really different and interesting, and that's where I do behavioral health consulting. We call it BHC, behavioral health consulting. I'm following the medical team on those days when I'm a BHC. And when patients come in to see their medical provider, if there's a behavioral health need of any kind, and this can include mental health needs like anxiety, depression, trauma, substance use, it can also be things that would enhance their health in general. So it's kind of looking at the whole person. And if somebody comes in and they're having trouble with sleep, they're having trouble with their diet because they're not controlling their diabetes, quitting smoking, a whole bunch of different things, we can come in and meet with that person right after their medical appointment or during their medical appointment to try to focus on what can we do to support this individual and give them ideas about ways that we can support them, give them education, give them different ideas, and continue to meet with them to be that component of care where we're really looking at behavioral health.
That's awesome. Yeah, I was going to ask for you to elaborate more on like what does that team atmosphere look like, but I think you just summarized it really well, where you're really partnering with the medical side of it and looking at that from a holistic standpoint. And I think that's an awesome approach as a philosophy of a clinic. So that sounds like a fun role
It's
to have.
it's actually really, really fun, and literally we sit in the same room together. So the doctors, the chiropractor, the specialists, and the behavioral health team, we all have kind of cubicles within one big office. So at any given time, I can one of the providers will say, "Hey, I've got a patient that I really want you to meet." And I'll say, well, I'm in the middle of a call. Can they do lab work first? And then I'll come in after that. Or we try to sort of plan the visit so that we're not letting somebody sit there for too long. So my days when I'm doing that consulting role are very busy. So I'm kind of running from one place to another, meeting a number of different clients all in the same day. But it's really
Yeah.
rewarding work and really fun to be a part of a team that is really, like you said, trying to look at the whole person and do this much more holistic approach to health.
Yeah. Yeah, so you referenced traditional counseling and then, this piece. So, like on any given week, are there certain days that you are just like you're taking appointments like 9 to 5 and then you're on the
Right.
behavioral side of it? So, those days look completely different for you too.
Right. So that is kind of how up until COVID happened and things kind of just went haywire. And now that I'm working from home, my days, we still try to keep certain days to be just traditional therapy versus BHC consulting days, but they get a little bit more mixed up when we're just working virtually. But in general, when I'm at the clinic, there are certain days that I'm just the BHC and I'm back in the medical wing. And then there are other days where I'm in my traditional office. I have like a regular therapy office that's a little more comfortable and cozy and private where people come in and they're meeting to just have their traditional therapy sessions. So we've really tried to keep that mix going. It's not without its challenges, but generally what we do is if somebody is seeing us in a consulting role, but really want to get into regular traditional therapy, we'll kind of say, well, let's see how the consulting goes. And we'll see somebody for say 5, 6 brief sessions. Those sessions tend to be like 15 to 30 minutes long. And if somebody's really seems really committed and they do want to work on some bigger, deeper issues, we will do our best to kind of work them into the traditional therapy schedule. But it's tough. The schedules are tight.
Yeah. Yeah. I'm sure they're even getting more tight as the needs have probably grown in the
Yeah.
mental health world too. So she typed a question into the chat and she's just wondering, as someone who works in the mental health field, if you can take your crystal ball with you. How do you anticipate that field changing over the next coming years? And as it may be like the model that you have established at your clinic, something that's going to be more common in that world.
I really hope so because I think I see this idea of mental health being a part of our overall health, being just that philosophy and that kind of mindset changing. I think that that is going to become more commonplace, that we will see behavioral health specialists kind of in different areas where we would normally find our medical care. I think that will just become more and more common. So, like, currently, I know that they have behavioral health consultants just like me who are working in emergency rooms. I think that we will see it in nursing facilities. I think we'll see it in lots of different places where you can imagine there being a need for behavioral health care. I think it's also shifted kind of the idea that not all behavioral health needs need to be addressed with quote unquote therapy. Many things can kind of be addressed with sort of brief, more solution focused support and education. And I think that if we can kind of continue down that road, I think you're going to see certain specialists emerge to have that more mindset of consulting, behavioral health consulting. I think there's always going to be a need for the longer term therapy too, for people that have experienced trauma or have more long term issues that they need to work through. But I think that this short term consulting piece is going to become a bigger, more widely accepted area for people to move into.
Yeah, that sounds really interesting too. And the philosophy is it's maybe more proactive versus traditional counseling might be reactive, where you're waiting for someone to come to you with trying to address a need. So that's an interesting trend moving forward.
Yeah.
Yeah. So Aaliyah had a question, and this is getting into some of the day to day and maybe dealing with patients. But if maybe you're working with a patient that doesn't want to cooperate or doesn't want to share, like what skills do you use that help them, kind of dig in and want to make some of that progress?
We were trained at a hospital setting down in Tennessee when we all got trained to do this consulting role. There's a integrated care training center down at Cherokee Health Systems in Knoxville, Tennessee, and we all had the opportunity to go down there and kind of observe and get trained. And one of the things that I learned when you are first trying to meet with a patient, a lot of times, right, there's so many mental health needs that come in just to see their doctor. They're coming in to see their doctor, but they really have a behavioral health need. And the more that they trust their medical provider and the more that that medical provider trusts me, the easier it is for me to kind of get a foot in the door and try to work with that person. So we would start off very gradually. So I might get introduced by the medical provider. He might bring me into an appointment with a client and say, I really feel like Christine could help you work with. She's got some really great tools and ideas of how you might work on your anxiety or how you might work on your diet or how you might work on your sleep behavior. And I find that if the patient feels like this is something the doctor thinks is a good idea for them, it makes it a lot easier for me to kind of come in and start to establish that relationship. And I think the more we meet with people and we try to just get them to make small changes, if those small changes lead to improvements for that individual, the individual is more likely to come back and say, you know what, that actually was helpful. The ideas that she gave me were kind of helpful. I used this one and I used this one, and maybe I would like to meet with her again. So we don't make it mandatory for any of our patients to see us, but we kind of leave it an open door so that as issues come up and they might meet with me one time just very briefly and think about it, and then maybe the next time they come in they're much more willing to say I would be willing to meet with her again. And the other thing I think that we realize, and you all might realize this already, is that I think every personality of behavioral health counselor fits with a different type personality of patient. So if I'm not a good fit for that patient, we might try one of our other BHCs. And we have, three of us at the Sheboygan Clinic and two of us at our Manitowoc Clinic. So that's nice too, that we kind of have a choice. If it doesn't seem like a good connection, I might then have my colleague Amanda meet with that patient the next time around to see if that might be a better fit.
Yeah, that's great. Haley also was wondering, I think we hear about this a lot as I'm sure behavioral health therapists, you spend a lot of time working with people who might be struggling or having certain challenges. And And if that's what you would spend your entire day doing, I'm sure that can be taxing on you, as a person as well, carrying some of the burdens that you're working with your patients. So, do you ever get exhausted, as she said, listening to other people's trauma and issues, and like how do you kind of help prevent you from carrying that or carrying that weight?
Yeah.
Well,
This is a great question, and I saw this come up on the questions that were sent to me prior to today's session too, that people were wondering about this, and I think it's a great question because I think there are behavioral health therapists out there who would say that they get burned out or that they're maybe not paying enough attention to their own self-care. So I think it's become super important as mental health providers that we practice what we preach, meaning I take pretty good care of myself. The basics, eating well, exercise, social support. But then more than that, I think that having a community of support. So that for me, that would mean my team, right, at the clinic. If I'm troubled with a patient story or there's some issue that comes up with a patient that I feel like I have people that I can go to and say, I'm really worried about this person or this came up and I am not really sure what to do with it. I also have my own network of other counselors who I do consultation with. And I think that kind of supervision and support, whether it's colleague to colleague or having a clinical supervisor in my past jobs and in my current job, becomes hugely important for taking care of myself, making sure that I'm keeping my own perspective. Because you're right, sometimes there are a lot of people who will ask this question, isn't it hard to listen to people's problems all day long? And that's not really how I see my job. I see my job as trying to be a support and helping somebody feel better. And many times they do feel better and they do feel supported, and that makes a difference. And I think when you can make that kind of difference in someone's life, it can be super rewarding.
yeah. And speaking of rewarding, or just even fulfilling, so what would you say is the most fulfilling or rewarding part of your job?
That's when someone is doing better and they're at a point where we're talking about spreading out sessions, hey, give me a call when or if, you need some help, or, telling somebody like, I think you're doing great. I don't think we need to schedule in 2 weeks or 3 weeks. I think we can, let's push it out. And I think that feeling of somebody knowing that now they have the tools and the skills and they're doing better and they're feeling better, they know that they could come back if they needed to. It's really rewarding. It's hugely rewarding to see people move forward in their life and feel good.
Yeah, but on the flip side, what do you think is on some of the challenges that you face in your role?
I think like this current pandemic that we're all dealing with, we have patients who are struggling greatly, right? So when you know that you have patients who are living in poverty, who are unemployed, who are living alone and have been alone for now, almost a year or 10 months or whatever it's been, that's hard. I think when we feel like maybe we don't have enough resources to meet the needs that are out there, that can be something where, I might worry about somebody off hours or I might worry about somebody on the weekend. And that's one of the downsides, I think, of the job. I really tried to have a clear separation between my work life and my home life, but there inevitably have been times when I've worried about people. And that's where having a team and having other people to help think through problems or help think through what can we do becomes really, really important.
Yeah, that's great. And Emma was actually about to ask you, how do you manage to separate your own life from work
Hmm.
with your
You
patients?
know, I let clients know pretty clearly my work hours and my off hours. So even if there are clients who might have access to my voicemail or my email, because we now are using email to kind of coordinate appointments, I'll say to them, I want to use email for coordinating times and appointment times and cancellations if we need to, but I really don't want you to use it for therapy. I don't want you to use it for any like major issues because for that reason, I said when I'm done at night or when I'm off on the weekend, well, you shouldn't expect to hear back from me. But here are the people that you can call if you really need to. And here's the mobile crisis number, or here is the number for our behavioral health care manager at the clinic because she can provide some support when I'm not around. And that's why having a team, again, it becomes a really important thing when you're doing this kind of work. For me, it has been.
Right. Yeah. And I think email in general, whatever industry you work in, if you kind of let answering emails outside of your working time frame creep into your life, that can quickly disrupt
Exactly.
that balance that you're looking for. And I think we're all, as adults, probably guilty of that.
Yeah.
Okay, so I just want to talk through. I mean, we talked about your college, your educational training that you had, but I think there's other pieces with like licensure that I think we
Oh,
should
right.
touch on a little bit more. And a couple of our students are talking about like being possibly interested in working with children versus adults. I mean, do you currently work with people only over the age of 18, or do you also help support under 18 as well?
So I do work with I kind of have my cutoff generally 13 and up if I'm doing more traditional therapy. Now for my BHC role, I will do younger than that, but generally I'm keeping those visits. Those I would not say are really therapy visits. Those are more like well child visits, right? So if a 8, 9, 10 year old comes in and there's some they're coming in for a well child visit and maybe I'm just popping in to talk about maybe a sleep issue, or I'm talking maybe a little bit about anxiety and giving some tools and ideas to that family, or I find myself giving people a lot of sleep hygiene ideas and getting rid of technology in the bedroom and those kinds of things, right? But I basically have kind of chosen to not work with kids, and that was just a more of a personal thing, and where all these different doors that I talk about have kind of led me to not be working with kids. But I think once you're in graduate school and you're doing internships, and you're at the point of you're doing internships and placements at different places, I think that's when you're kind of making that decision, like where do I want to specialize? And I don't think it's necessarily a hard and fast decision where you have to kind of say like, this is my population and I'm going to stay there forever. Because certainly if I decided now I'd like to get into more pediatric stuff, I could definitely go and get some training and show that I have the skills and the training to be able to do that. But usually it's where you land in graduate school and where you choose to do your internship and your hours post graduate school that really tend to lead you into a specific population. You don't really have to make a big decision about that until that point. But like you were saying, once you've made the decision, like I really want to go into being an actual behavioral health therapist and I'm going to get my master's degree, then, there are programs that you would have to make decisions based on what specialties they also offer. And then once you're done with your master's degree, you have to become a licensed trainee. You have to get your training license, and then you have to do 3,000 hours post master's. And for a lot of people, that sounds daunting. And what I usually tell students is once you're working in the field and you're kind of in the right area, that doesn't feel like a long time. That's actually really good experience that you're getting. And when you have your training license, it means you have a supervisor who is working with you every single week, and providing supervised guidance to you, and that becomes super valuable too. So it sounds like a lot of hours, but that's all the experience that you really need to become a good therapist.
And that's, I mean, essentially 3,000 hours. That probably would equate to like a year and a half to maybe 2 years
Hmm.
post your education graduation on completing that licensure, right?
Right.
Are you ever able to find paid experiences like that, or
Yes.
is that something that would be unpaid?
Yeah, no, the more and more I hear of people as LPC. So I'm a licensed professional counselor. There are licensed social workers, like I was saying before. There are different areas that you can get into. If you want to go into assessment and testing, you would go into more of a licensed psychologist position. There are different sort of specialty areas that you get into once you get to that point. Once you're maybe through your bachelor's degree, then you're making some of those decisions. If you finish your bachelor's degree in psychology and you're like, wow, I'm not really sure what I want to do, I would kind of say maybe it's time to go work in the field for a while. There are jobs that you can get as a bachelor's in psychology, doing case management, working in a clinic setting, working in a hospital setting. It may not be doing therapy per se, but you would still be getting exposure and understanding maybe more about what population you want to work with before you move forward and figure out what you're going to do for your clinical population stuff.
That's great. That's great. And students, I'm going to be posting just an evaluation into the chat. We're getting closer to the end of our time here. So if anyone has to jump off, you can fill out the evaluation and then take off. But let's talk about like things that you could do while you're in college, or maybe even starting while you're in high school. Ariana was wondering, Is there like any like jobs that you could do that would align towards the mental health role while you're in college to help maybe build that background and some of that expertise? Like what are some things that you could do during that time to gain some experiences to help you prepare for this role?
Yeah, that's a good question. I think the hardest thing, when I think back on sort of my pathway, right, the job that I got right out of college when I was working at that group home with individuals with severe and persistent mental illness, that was certainly like a major training ground for me. And those are jobs that you can get, I think, even without a degree. So if you really wanted to get more experience, you could either look for volunteer opportunities in those kinds of settings, home health. There's like this huge expansion in the home health industry now where there are home visits needed and people who deliver medications who maybe don't have an advanced degree, but who want to gain more experience and maybe more exposure to those populations. So those would be some areas where you could kind of look for those opportunities. And certainly, like if you can do like job shadows through Inspire, and maybe Nikki, you can speak more to this. I don't know if there are other job shadow opportunities that you guys offer in the field, but like a social worker in a hospital setting or in a nursing facility, or typically I would think those places would maybe offer some opportunities for either volunteer work or people who don't have advanced degrees to get some experience in the field.
Yeah, definitely. And right now from students just I mean as you can understand job shadowing is not something that many healthcare professionals are able to support right now just
Right.
we're trying to manage the pandemic lifestyle right now, but one of the things we do encourage you, especially if it's in a healthcare related role, that volunteering component is going to
Hmm.
be critical because one of the things to note is going into to do a job shadow, especially in a role where you might be working with like another patient. You can't just bring a student in to sit in on a session, but when you start in a volunteer role with a facility, there's actually things that you are able to do because you're a contractual volunteer for them, and you're able to see and get more exposure in that capacity. So we definitely encourage exploring volunteerism as a way to get more access to some of these
For
careers
sure.
in our field.
We have at Lakeshore too offered some job shadow opportunities. People have come in specifically kind of asking, like, could I shadow your chiropractor? Could I shadow your, BHC? And not in therapy so much, because you're right, therapy is a little trickier to gain experience or to have people actually come into the room and shadow. That was easier for me when I was doing college mental health. When I
Mm.
was working on a campus, I found that students were much more willing to let my interns shadow and observe sessions, just because I think they are students themselves, and so they tend to understand more like it's needed, right, to have other students come in and observe. So when I was working there, and I always had interns at UW Sheboygan, and they were allowed to sit in on sessions and gain that experience. But even at Lakeshore, we've had a couple of job shadows come in and watch how we work as BHCs.
Yeah. Is that an opportunity right now during the pandemic to volunteer as well, or is that still a
I
challenge?
think I would probably wait until maybe, until we get a few months down the road here. And when there's a little more freedom with this pandemic, then I think those opportunities are going to open up again.
Great. Yeah. And to our friends with the new AHEC, if we do have a couple of students that have been messaging me about volunteer opportunities right now. So if there are any, if you guys want to just enter some in the chat, that would be helpful.
Mm.
So we just one last question, and then we'll let you sign off here. We do appreciate you for your time, but from a high school student, is there certain classes then in high school that you would recommend for someone that's maybe trying to decide if a behavioral health role would be something they're interested in?
I know most high schools do offer like psychology, at least intro classes. I
Mhm.
also think kind of any, sociology related class. I think part of what you kind of need to figure out as you're thinking about a career is you need to kind of figure out how much do I want to work with people? And whatever classes might help you kind of sort through that, like what kind of role do I want to be in with different people? I wouldn't consider myself to be like an extrovert in any way. So I think people need to not think about it in those terms necessarily, because I think I'm kind of introverted, but I still really enjoy working one on one with people, right? I generally am not like a big group person, but I found a job that I really, really enjoy, and it does require me to get outside of my comfort zone a little bit. But, I think that any classes that you can take that will help you kind of determine that would be helpful.
That's awesome. Great. Well, Christine, thank you so much for your time.
Yeah, I'm so glad to see so many students interested in this area because I think it is going to become a bigger area for people to get into. And I think a lot of students this age realize that mental health, behavioral health are important things that we're now paying a lot more attention to.
Right. Yeah. I do think in the last, 15 to 20 years, people have become much more open about, sharing challenges in mental health, which I think has helped people understand that it's okay to seek help and really help that field grow. Yeah. So thank you so much for your time and for
You're
this
welcome.
are on today. We are going to be showcasing another behavioral health therapist, but this one will be coming from a college campus in April. So if you want
Awesome.
to be able to see both ends of the spectrum and talk to a couple of other people that have this career field, feel free to join us for that April session. So again, thanks so much for your time, Christine,
You're
and
welcome. It's good to see you.
nice to see you too.
Thanks, everyone.
Okay, bye.
Bye.